Welcome doctors to my lecture. We are studying cardiology. Today we will discuss an important topic, that is the interpretation of electrocardiography called as ECG or EKG. So let's start. Don't forget to subscribe my channel. It will help us to keep uploading more videos like these. This is a normal ECG. P wave shows atrial depolarization. QRS complex shows ventricular depolarization. T wave shows ventricular repolarization. PR interval is the AV nodal delay. Atrial repolarization is masked in the QRS complex. This is a normal ECG. In a normal ECG, the interval between two QRS complexes is equal, which means that the rhythm is regular. The PR interval is normal, that is 0.12 seconds, and the P waves precedes every QRS complex. This is the ECG of sinus tachycardia. Note that it has all the features of normal ECG except that the rate is increased, which means number of QRS complexes per second is greater. This is the ECG of atrial flutter. Note that the rhythm is regularly irregular, which means that the RR intervals are equal, P waves are absent. Back-to-back atrial depolarization waves forms a sawtooth pattern. There is always a ratio between atrial depolarization waves and R wave. For example, in this case it is 4:1, which means that 4 atrial depolarization waves and 1 R wave.
Now we will discuss atrial fibrillation. This is ECG showing atrial fibrillation. Note that the rhythm is irregular, which means that the RR intervals are unequal. P waves are absent. Back-to-back atrial depolarization waves forms an erratic or chaotic pattern.
Now we will discuss ventricular fibrillation. This is the ECG. It is a completely irregular rhythm with no identifiable waves. It is fatal arrhythmia. These are the important points you should always remember. Please memorize these on fingertips. Please read the question and options carefully. Take your time.
The catch point in this question is a irregular pulse, in which PR intervals are unequal, which occurs in atrial fibrillation. So the correct option is C.